Hello, welcome to Erlanger's Joint Replacement Program. I'm Jason, I'm one of the nurse navigators, and today we're just going to be talking about what you can expect from pretesting through going home at the end of your hospital stay. Pretesting usually takes place about 10 to 14 days prior to surgery. When you come in, we'll ask a lot of medical questions so we have a good understanding of your past medical history. We'll also get an accurate list of the home medicines that you take on a daily basis. We will use a swab to check your nose for staph. A small percentage of patients in this area have a staph colony in their nose. The presence of that staph colony does increase your risk for infection after surgery. To eliminate that risk for patients who have a positive culture, we will call in a medicine for you called Bactroban, also known as mupirocin. You'll use this medicine twice a day for 5 days prior to surgery to eliminate that staph colony and lower your infection risk. The pretesting process will also include some blood work. For skin prep, to ensure that your skin is bacteria-free as possible before surgery, we will give you a bottle of a soap called chlorhexidine gluconate, or CHG. You'll wash with the soap 2 times prior to surgery. The first time the evening before, and the second time the morning of surgery. After asking all these questions, we won't see most of our patients for another 10 to 14 days. If you have any changes in your medical status, please let one of the navigators or your surgeon know.